Hi, Daniel here. This is a quick introduction for a video I made of a rant in October last year, saying I believed that the healthcare provisioning for people with long COVID was going to go wrong, and that people wouldn't learn the lessons from ME and chronic fatigue syndrome. And after reviewing the video and following a few people here and there, I think I'm right. There was a slide I saw recently when from an eminent cardiologist talking about long COVID, who said that patients should be in the driving seat of care. He said they were probably more in the back seat. I think in a lot of cases they're probably actually in the boot. Anyway, have a look at my rant. Let me know what you think. Be interested to hear. Thank you. Hi, it's Daniel here from Pain and Performance. This morning I said I could feel a rant coming on about, I'm just going to read it, coming on about wasted opportunities of ME and long COVID and how the mistakes of the past are just about to be made again. Yeah, they are. I think I've got two things that I really want to rant about, although I'm going to try and not rant too much. I'm just going to try and be calm and collected. So anyway, first off, we're getting, if any of you saw the BMJ podcast the other week, there were a few notable medical personalities or social media personalities on there, and they were very much speaking about how listening to patients was important, getting the patient's experience and learning from them and providing a service that patients actually wanted. This doesn't seem to be happening. If we look online, we're seeing proposed plans for new long COVID clinics, new ways of managing people in the community with long COVID. There've been a load of posts and various other bits of people proposing ways to do it. And for so many of them, it seems to bear little from what we've learned from ME, another illness that has post-exertional malaise and brain fogs and muscle aches and all these things. The two almost go across to each other. And we've learned from that pacing really doesn't work. Pacing works. The PACE report is what I was talking about with graded exercise therapy doesn't work. It makes people worse. So you can dress up your graded exercise therapy in lots of different ways. You can talk about, you can do it a little bit faster, but do a little bit less. Or you can walk a little bit further. Or have you thought about doing a little bit more weight? And you have all these things happening. They're dressing up, they're using old stuff that never worked and trying to present it to you in a fresh new way because it's going to work this time. Well, do you know what? I don't think it is going to work. Hi, whoever's there, can just see there's one person watching. But you're giving people something that doesn't work. You're giving them pacing again. You're not listening to your patients. You're not listening to anyone. You're just talking amongst yourselves and deciding what you have and just pushing it on people that have no interest in it because it doesn't work for them. And they'll go to you and you'll give them graded exercise therapy and they'll start doing it and they'll get worse. They'll get worse and worse and worse. And then they won't go. And you'll send them a letter saying, they're not complying, they're not coming to appointments. And we can't treat you if you're not going to comply. And you'll boot them off your treatment program. And in a way, the statistics will show that that wasn't a failure. And because that wasn't a failure, it must be some sort of success. Because you haven't failed there. Because the person didn't comply with what you wanted. You must do something about graded exercise. It's never really worked. You've got to listen to people with experience of that, and that is your ME patient population. They can teach you so much more than talking to each other, which is what you're doing at the moment. You need to do something different. Listen to people. Don't listen to yourselves. Take your blinkers off. Look in other places. The other thing that's happening is the provision of psychological services. Again, this is something you pushed on people with ME. It's not a real illness was the message. It's in your head, you just need to work a little bit harder, you just need to push a little bit harder, and that'll make it all better. CBT with the graded exercise therapy, that'll get you better. And this is what appears to be happening again. You're not learning from the past. ME should have taught you that this approach didn't work. Yet you're going for this approach again, and it's going to fail. And in the past, you alienated the ME community, and you're going to do that with the graded exercise community. And you're not going to understand why, because you didn't listen. We talk about listening to your patients, let patients lead you, let patients guide you. And even before you started, you're not doing that. You're doing what you want to do. You're designing services and protocols that fit the components you have without actually looking for new components, without actually looking for new bits, without listening to what people are doing. And that is why your clinics stand a high chance of failure, because people aren't going to want them, because they don't want them, they won't work, they're going to make them feel worse. That's the first complaint. That's my first little rant.